I'm John O'Halloran from SITFA. I'm responsible for SITFA's management consultancy operation. So why has SITFA and Xantura joined in this partnership? Well, the current social and economic situation that we find ourselves in is not a temporary situation. We are going to have to live with it going forward for a significant period of time. Decisions therefore need to be made on as comprehensive predictive data as possible if they are to be relevant and accurate in relation to the delivery of quality services, particularly in what is a very resource constrained environment. Predictive data needs to be drawn from a wider base than just a single local authority database. As local authorities are operating in a complex environment, decisions now more than ever before need to be informed about what is happening in people's lives, their work, their education, health, communities, to ensure that services are not only fit for purpose, but they are the most effective use of resources. We need to get the maximum out of every pound that is spent. How do we use this tool going forward? The example that you're going to see is a COVID-19 example, but that's not the only issue that this tool can solve. It would be most effective going forward in helping to shape and make informed decisions about how the medium-term financial plan for a local authority is put together. There are other tools that can be used with this as well. There's an income generation tool, a finance management and resilience review tool that SITFA has that complement the working of this tool. Together, they help to take the uncertainty out of some of the decision making. In essence, they support informed decision making based on accurate data going forward. I'd like to hand over now to Mark Dell from Xantura, who will walk you through the OneView programme.
Okay, good afternoon all. This session is just to go through the solution in terms of the Xantura COVID case management solution. It's a web-based application where all the data contained within the tool is what we call pseudonymized. What pseudonymized means is that the data, as part of the transmission from the client to the Xantura secure data center, is split into two sections. One being the personally identifiable data, so names, dates of birth, etc. The other being the sensitive data. And only the identifiable data is matched within the Xantura data center before it can be joined back together via what we call data sharing protocols. So at the top of the screen, you can see our DSP ID, which in this case, we're going to be showing the COVID-19 DSP. This particular user has access to various other data sharing protocols, which based on their user role, gives them access to the associated case management facility or reporting facility. So for today's session, it's going to be the COVID-19 DSP that we use. So from the drop down, you can see that the case management tool for COVID is built in three components. So we have a case filter, a case composition, and a case details section. We'll start by showing the case filter session. Okay, so within the case filter, whilst the identifiable data has been blurred out for presentation purposes, given this user's access to the data sharing protocol, the data has now been de-pseudonymized and can be joined up. So we can see both the personal data and the sensitive data together in a single view. The case filter itself contains at this point all those cases that have identified with at least one COVID risk factor, or the cases have been already contacted by the local authority in relation to the COVID support needs or health needs. So within the case filter, the data has been sorted in relation to the number of risk factors that we've identified within either the household itself as a whole or as the individual themselves. So at the top of the list by default, we'll have those with the most risk factors that have been identified. The case filter section then has got two methods by which the data within the grid can be filtered. So the top section of filters, which contain things such as geography and age band, etc. The cohort can be filtered by either of those categories. More importantly, the user is able to filter the records by a predefined list of cohorts, which can be saved for the user to come back on another session, and can be appended to with various combinations in terms of the caseload that the user wishes to identify for additional support. So in conjunction with the cohort, the user is also able to utilize the OneView risk filter. Now, the OneView risk filter is based on Xantura's selection of predictive risk models. The predictive risk models have been built in order to identify potential future outcomes for individual people. So, for instance, the risk models currently in use are adult social care, unplanned admission, children's social care in terms of step up to a higher level of service, homeless risk model to identify those cases most likely at risk of homelessness. So in conjunction with the OneView risk filter and the cohort filter, the user can define their own simple cohorts, which can quickly filter the list to a much shorter cohort and a more manageable cohort that can be used to proactively target support and services. So we just select a combination of the filters. We'll use adult social care, and we'll use a cohort that we identified over 65 years old and within currently known to adult services. We've also got a category for cases that have been loaded and matched using the NHS data. In this case, it's the self-referral data. So we'll also select a combination of NHS data as a filter. So we select yes, and we've filtered down to a very small manageable list in terms of what could be utilised as the cohort. So additionally to the top level filters, which can be cleared at any point, we also got, for each of the categories of risk, a filter for each column of risk. So we've got things such as respiratory, cancer, mental health, disability, lives alone, blue badge recipient, free school meals, etc. All the identified likely COVID risks. So I've selected a further filter as an example, and the option of no, and then left with a single case that I could then subsequently review. If I go back to a wider list, I can just clear the filters, which will present the list in risk factor volume order, and I'll just select a cohort where we've had NHS self-referral data, which will filter it down a little further. And then if I then select a record from the left-hand side, the select option, can scroll down, we can see the case composition section. The case composition section is a full list of household members and their associated risk factors. So we can see those across the piece for each of the household members. So the third component within the tool is the case details section. The case details section itself is split into 4 different tabs. You just scroll down. Service monitoring tab contains details of any services that the client is in receipt of. So in this particular instance, we've got adult services and we've got their intervention details, a care plan, associated care reference, and a start and end date where the data is present. Where more data is available, we have the paging where you can view all data associated with services, or if you want to view it in a single page, you can increase the page length to include all. You can see additional services there at the bottom. We'll skip assessment and come back to that. The case notes section, we can just simply add textual notes for a particular case. We can add that note which can be viewed at a later date. We've got a fourth tab there, which is called NHS data. Now, again, where this has been provided and has been matched to a particular record in the COVID list, we can see the NHS data typically from the self-referral lists or from the Cat A lists. We can see the data that was included and provided from those NHS lists. And the final tab is the assessment tab, where you can see the number of questions in support of the assessment process in relation to COVID, where symptoms can be recorded, health conditions, support needs, and these can be recorded and saved for future reference. We're also in the near future, in the next development phase, looking to add a track and trace facility to this section in support of the track and trace programs. So they're the three sections. If we just scroll back up and across, for the record that we selected, we've also got the facility to record specific information around contacts, associated triage lead person, any action that triage lead takes, along with the associated action dates, and they can then be referred on by the user to a specific team or to a specific person. So the edit function allows us to do that. So we can just populate the associated with triage lead. The triage lead details can be selected and stored, along with any associated action. And an associated action date. And that can be saved. Referral details are automatically recorded based on the user that's logged in at the time, along with the date of that recording. If required, subsequently, details can be added in relation to who that referral has been referred to. So we'll say referral to social care, and again, we can save that record in order to assign appropriate teams or people to proactively target support moving forward. So that's the overview of the COVID case management tool. Any questions we'll pick up as part of the webinar. Thank you.